So I'm here this evening with Dr. Lee Voulters, who has served as a past president of Mississippi State Medical Association. We're so grateful for Dr. Voulters' leadership and service throughout his time and involvement in organized medicine, both at MSMA and at the American Medical Association. So, Dr. Voulters, I know that you practice neurology in Gulfport, Mississippi. Can you please share with us some tips that you found to be useful for the general public and for our Mississippians as they continue to navigate the uncertainty of these difficult times?
Yes, thank you, Abney. Thank you, and I appreciate. I think it's a great idea of the State Medical Association to get a few of us to talk like this and to get word out to the public. It's very important. I think the number one thing that's central to this pandemic with COVID-19 is social distancing. I think that is so important. People just have to understand, and I think they've been doing a great job, that we have to keep 6 feet apart. We cannot congregate in large groups. We have to limit it to 10 or less. When we go into elevators, there should only be 3 people in the elevator at one time. So 6 feet distancing is number one, the most important thing. And I know there's been some confusion about masks at first when the guidelines first started to be talked about back, several weeks ago now. A lot of the experts would come on television and on these websites and say, well, we're not sure that masks are really that important, but as long as you keep 6 feet apart. And that has changed. We've learned more about the virus. There's tremendous research going on with the virus, and we learn more about it. Plus, we've seen what people are doing with their social distancing. So masks, I think, are really important when you go out in public, because you can't always guarantee when you're going to the grocery store, which of course is essential. So we've got to get food, or when you have to go anywhere which is essential, and it should only be really essential travel and essential pastimes or essential chores that you have to do. When you go to these essential places, wear a mask, because you can't always guarantee when you walk into Walmart to get your groceries, you're going to be walking past people. You're not going to stand in line close to them, because they've already put into effect these lines where you have to stay 6 feet apart. But you're going to walk past people and you're going to be closer than 6 feet. So wear your mask and stay a safe distance away. And I think that's very important. And with your families, I know we're home a lot more with families, which I think which is a good thing. I think we are being able to spend more time with our families. We're not such busy lifestyles, but please be careful. And when it's Granny's birthday or an anniversary, you just have to resist getting the whole family together to celebrate. You're just going to have to do it at a distance. Do not congregate with lots of people in the family. Keep Granny safe at home. Don't have the kids go around. Stay on FaceTime or stay on the phone until these social guidelines and distancing is relaxed, because as it stands now, we're doing a wonderful job, and we can see by the numbers that, in fact, because of the public doing their social distancing and following the guidelines along and not congregating in churches or in synagogues and not congregating in restaurants, etc., that the coronavirus cases are going down, and less people are going into hospital, and of course there will be less and less deaths. So we're winning, but we're only winning because we're doing this. So it's very important to keep it up. Wear your mask in public, stay 6 feet apart, and don't congregate in large numbers at the moment.
Great. Thank you so much. Can you share any places that the general public can go to in terms of, searching on the internet for reputable resources? What are good places to go to find tips?
Absolutely. We're talking, and we're both members of the State Medical Association, MSMA, and we have a wonderful website which gives a lot of resources and explains a lot of things in more detail. The AMA, of course, is a wonderful resource. We are members of the AMA. It represents over 90% of doctors in this country, and they have some wonderful resources. And anything you really want to know about COVID-19, the virus, and guidelines, and what we should or should not be doing, how to visit people in hospital, how to go to hospital. In fact, I'm sorry, but you're not allowed to visit people in hospitals now. But it explains what you can and cannot do. and how you should contact your doctor if you're sick and not go to the emergency room unless you have certain symptoms. And so it tells you all these things, which I think are very, very important. So the AMA, the MSMA, the State Medical Association, as well as the CDC are wonderful resources.